First, I want to point out that the Houston Health Department has developed a really unique partnership with HISD with this wastewater project. Of course, our departments have worked together on many things over many years, but this is truly unique. And I think that the audience needs to recognize that HISD is the only public school district in the nation participating in a wastewater surveillance project like this. I fully expect that this will become more common as time goes on. We're already seeing it popping up in other communities, but hopefully in other school districts as well. And this is probably just the beginning, and HISD will have been at the lead of this, and that's what history is going to reflect. So again, thank you for helping us set this up. All right, so let's talk about what we're doing here. So it all starts with collecting the wastewater samples. And we do this in a couple of ways. First of all, the wastewater sampling at the 39 wastewater treatment plants that serve the city of Houston is done once a week in a 24-hour cycle. So for 24 hours, once a week, we collect water samples. Now, in detail, there is one sample collected per hour across that 24-hour period. Now, the wastewater treatment plants, they serve communities of varying sizes, and the largest one covers an area that has over 500,000 residents. And some are obviously much smaller, but nevertheless, between all of those, we cover almost the entire population of the residents of the city of Houston. Now, in addition, we also collected 74 separate individual manholes. Now, the manhole sampling is really designed to narrow in on one particular facility, and therefore the sampling that occurs through the manholes really only reflects what's going on for the people that are either living in or using that facility. After the samples are collected, they're then taken to two labs, one at Rice University and the other at the city of Houston. And this redundancy is on purpose to make sure that there's good quality control. The wastewater is then looks for the viral particles in a manner that we can kind of measure the load. And it's the unit of measure for this is the number of copies of virus per liter of fluid. And we're going to get into a little bit more detail about this as we go on. So just bear with me here. Now, after that value is determined and it's been validated between the two labs, it's put into some pretty complex statistical models, which allow us to sort of identify the trends, which direction the volume of virus is moving in those samples. And we're able to do it in a way that looks at it both over time and geographically. Now, those results are then communicated to the health department, where we can post it on a public dashboard, and we'll be showing that to you in a little bit, on a wastewater dashboard. But we use it to help us make public health decisions about where to focus our efforts, because now we have an idea of where the virus is more or less active across the community. All right, so let's talk about why. Why are we looking at the wastewater? So when people are infected with SARS-CoV-2, it's excreted in their feces. And it's excreted in everyone's feces who's infected, whether they have symptoms or not. So as you know, one of the challenges we've had with combating this virus is that up to 40% of people will have no or very minimal symptoms. And with Omicron, it's even worse, because so many people are saying, well, I just had a little sniffle for a day or two, but yet they were infected with Omicron. And if you're infected, you can spread it. So the advantage of looking at the wastewater is whether you're symptomatic or not, we can detect the presence of the virus in the wastewater that comes out of the toilet that you use. When we do this, what we're actually looking for, if you can imagine, the wastewater, the feces goes in the wastewater, and unlike when you go and get tested where they put a nasal swab or a swab up into your nose in your nasal passage, they're able to retrieve whole sequences of virus. In this setting, we're looking for fractions. We're looking for viral particles. And so that's important to understand. And this all comes at the, where we sample from. So either the waste treatment plant or the manhole settings. Now, it's important for folks to understand we're testing the wastewater. This is a completely different system from the drinking water, and the drinking water is absolutely safe. There's no way. There's been some concern. People have asked, well, can I catch COVID by drinking water because it, is in the wastewater? No, they're completely separate. The wastewater goes through, all kinds of processes. The drinking water is a separate process And I can assure you that the safety and assurity of the drinking water makes it so that it is absolutely safe to drink. The other thing is that it's of interest, again, I kind of mentioned this a little bit earlier, but we are able to look at the entire community when we're doing it through the wastewater treatment plants, and we're able to narrow it in on just particular buildings when we look through the manholes. So let's take a closer look at the manhole sample. So right now we have manhole sampling going on at 51 schools. Now, one difference from the wastewater treatment plants where it's sampled for 24 hours once a week, at the schools, they're only sampling for a 6 to 8 hour period when the schools are full. So there's one difference there. And let's take a look at some of these manholes so you can get an idea of what they were looking at. So there's two ways of doing it. One is on the left, you can see, and if your computer has a resolution, you can see that on that bracket, there is a device way deep down inside the manhole sampling. And that's what we use at many sites. Now, to the right, you can see that there is a tube going into the manhole cover with a device that is doing the sampling and siphoning out samples during the sampling period. And so those are just a couple pictures. If you have something like that on your campus, then that you'll know that your campus is one of the ones that is we're sampling from. All right, so let's take a look at a sample, an example rather of the manhole report. So we list the results for each school each week. Now you can see that at the end of after the school, there is a number. So that number represents how many consecutive weeks there's been a positive sample. So we have Lyons Elementary highlighted there, and it is positive on that week, January the 10th, that manhole report, it was positive, and that one indicates that it was positive the previous week as well. Over to the right, we're able to look at the results over time. We call this a heat map. And this heat map can show the results for the past 7 to 8 months. And the dates are there along the bottom. Now on this heat map, red indicates positive, yellow indicates an inconclusive result, and blue indicates that there is a negative result. All right, so let's go ahead and let's take a closer look at some of these examples. Let's first take a closer look at a positive result. So here's an example of the heat map for the schools and zip code 77076. So let's zero in and take a look at Deschamps Elementary, where the sample was positive in both the week of January the 3rd and the week of January the 20th. So that meant that the samples present there had evidence of SARS-CoV-2 in them. Now, one note is that there's positive and there's high positive, and that's really just for the folks in the lab to worry about. They both mean that there was SARS-CoV-2 present in the water. If we take a look now at an inconclusive result, we can take a look at Barrack Elementary, and you can see that on November the 1st, off to the left on the heat map there, it is the brown or tan or yellow color. So that meant it was inconclusive. So what does that mean? That means that in the lab, they found some evidence that there might be some virus, but not enough to say for sure. And that it wasn't just, because again, we're looking for fragments of virus. So it's inconclusive. You'll notice that the following week, it was positive in this particular example. All right, so now let's take a look at a negative result. And so lastly, here with the negative result, we'll take a look at Sam Houston Math and Science. And on December the 6th, the week of December the 6th, it was negative. Now, interestingly, note that the week before it was inconclusive. So it then what turned out to be negative the following week. Now, one thing to keep in mind is that doesn't necessarily mean that there is nobody on campus that's infected. What it means is on the day that we did the sampling, nobody who was infected used the bathroom. So, anyways, just, sometimes you're going to have cases where we'll talk about this in a moment where the nurse will know of a positive case if the wastewater was negative. Well, maybe on the day that we did the sampling, that person didn't happen to use the bathroom. But when we do have positive cases, we have an outbreak response team that will go and help the school. So once we get the positive results, we notify the superintendent and also the school principal, and often, of course, the school nurse is involved. And we work with the leadership of the school to try and get an idea as to how many people there may be that are infected in the school. And then, the HISD has policies that can be applied. And, each school is its own unique environment. And so we work with the school leadership to do what we can to minimize the spread and hopefully, reverse what the spread within the school. And that team will remain with that school leadership until such time as we get a negative result. And as I mentioned earlier, we don't always have to wait until we get a positive wastewater. Sometimes there's, the school leadership knows before the wastewater turns positive. So sometimes once the wastewater turns positive, we've already got a team on site. All right, let's take a look at and discuss the other thing that we do with the PCR testing. And many of you are already familiar with the PCR testing program. And so here's a heat map looking at how we've combined and paired up the wastewater results with the PCR tests. And so, for example, on this slide, we look at the schools. Each one has two rows, and one is the PCR result. If the school had a positive PCR test, somebody on campus tested positive, it'll come up as red. And if nobody tested positive, it's white. And for the PCR testing, there's just the two. It's either red or it's white. Now with the wastewater, we still have the red, the yellow, and the blue. And you can see, for example, when we look at school 7, the latest wastewater was red and the PCR testing was red, indicating that school 7 had positive wastewater and positive tests. Now, if you also look for the week of January the 24th, school 7 had 4 positive PCR tests out of 48 PCR tests that were administered. So you can kind of get an idea as to, how much there may be within the school. Now, again, this, the heat map doesn't catch everything, but we often, in some cases, as you scan through, you'll see it. We've got it in the wastewater, but there were no PCR tests. So it's a double way of checking what's going on in the school. Now, if we take an overview of the wastewater dashboard, here it is. This is what is publicly available on a public website. And you can see that on this one, for example, for each of the wastewater treatment plants, and that's what those boundaries are, as you look at that map, those are the wastewater treatment plants. In this particular view, all of the numbers are moving down. So they all have downward pointing green arrows. So this is when the viral load across the entire city is going down. Sometimes, depending on when you look, we've got some arrows going up, and those would then be in red, and while others are going down, which are in green. But here they're all going down in green. You'll also notice that there are some dots on there, some green, red, and yellow dots, and those are schools. Off to the right indicates what the viral load is across the entire city and the city's positivity rate. So these are the values that were existing on January the 24th of 2022. Now, there's a tab down on the bottom, and if you click on that tab, that'll bring you to, there you go, there's the tab. That'll bring you, what it does, it brings up on the screen the positivity rate and the wastewater. So here, you'll notice that the green is the viral load in the wastewater for across the entire city. And the scale for that is the one on the left, which is also in green. You'll notice that is a logarithmic scale, whereas the blue line is the positivity rate. And that is, the scale for that is on the right side, which is also in blue, but you'll also notice that that is a linear scale. So don't be confused. The other thing about this, now this has a lot of time. So this goes back to July 6th of 2020. So this is a lot of months on here. It looks like these largely parallel, but if you were to stretch it out, you would see that the change that occurs in the wastewater precedes the change in the positivity rate generally by about 2 weeks. And this is one of the real advantages of wastewater, is it gives us about a 2-week heads up as to what's about to happen. Now, if you go down to the bottom there, you can see there's a tab for schools. So if you click on the schools, you'll then go to a heat map that shows that for all the schools are listed for the wastewater program. Now, this is the same wastewater results that we showed earlier. However, there's a little bit of a change in the color. The negatives are now green rather than blue, but the red is still positive and the yellow is still inconclusive. You can also view school information by clicking on the school map. And when we do that, for example, here, the green dot there, that's Durkee Elementary, and it's green. And so there is no, so the sampling there was negative. So it shows up as a green dot. Now, if you go back down to the tab that had the heat map, you'll see that the heat map now only shows the selected school rather than every school. There's one way to zero in on a school that you may have particular interest in, and you can see across time what the results were. Next, let's go ahead and take a look at the wastewater at the zip code level. And so you can do that. And for those schools that are not in a manhole water surveillance program, this may be a way for you to see what's going on in your neighborhood. So you can go and look at the viral load by zip code. And when you do that, it'll take you to a slide where it's the wastewater by zip code. So you see that map has changed. So before, you notice the boundaries were the wastewater treatment plants. Here, it's the zip codes, the individual zip codes. So now you can zero in on the zip code that you're in. You'll notice off to the right. So here you go. Here's zip code 77022. And here you can say that on January the 24th, off to the right, January 24th, that the positivity rate in that zip code was 22%, and that the unvaccinated rate in that zip code was 41%. Now, the viral load there is still what was the viral load. What we believe the viral load was within that zip code as well. And so these are ways that you can get information about your school if it's part of the manhole surveillance program, or by the zip code you're in if it might not be.